Thank you all for joining us today. We have convened this press conference to provide an update on the status of COVID-19 within the North Bay Parry Sound District Health Unit, including the status of our vaccine rollout. Today, I'm joined by my colleagues from our health unit who have been playing a significant role helping our community manage through the COVID-19 pandemic. I'd like to take a moment to introduce them to you. Dr. Carol Zimbalatti is a public health physician in our health unit. She has a background in family medicine. Dr. Zimbalatti has been leading efforts related to infection prevention, particularly working with a variety of agencies like social services, long-term care, retirement facilities, treatment centers, shelters, and other institutions on COVID-19. In addition to infection prevention, Dr. Zimbalatti has been working on mental health strategies and supports related to COVID-19. Also joining us is Shannon Mantha. Ms. Mantha is the Executive Director for Clinical Services and our Chief Nursing Officer for the District Health Unit. Ms. Mantha oversees all of our clinical programs as well as the COVID-19 response for case, contact, and outbreak management and infection prevention, working with healthcare partners across the region. Finally, we have Andrea McLellan. Ms. McLellan is the Director of our COVID-19 Immunization Strategy. She has been a registered nurse for over 35 years. She is currently responsible for working with the Ministry of Health on vaccine supply and administration protocols, and leading the development and logistics for our health unit's immunization rollout. In this role, she is working closely with many of our community partners, including all 4 hospitals within our region, long-term care facilities, Indigenous communities, and other healthcare and allied partners within our region. The 4 of us will be available to answer any questions you may have after some brief remarks. So as you well know, on Friday, the provincial government moved our health unit into the red zone of the provincial framework. This means that businesses can reopen with strict public health measures in place. We are supportive of this move, particularly as it slowly eases us into reopening in a responsible manner, consistent with the pace of reopening in neighboring regions. Over the past couple of weeks, there was much public debate about our region's recommendation to remain in shutdown with the stay-at-home order in place, despite our relatively low case count. I want to take a moment to explain why we felt that was necessary and what we think that achieved. Case counts and hospital capacity are very important factors in determining how much we can reopen, but they're not the only factors. There are 2 other issues that played a key role in determining our recommendation to remain in shutdown: the status of infection and reopening level in neighboring jurisdictions, and the presence of variants of concern in our district. So let me explain. We're not an island. If we progress to a green zone while surrounded by red or gray zones, human nature is such that people would travel to a region, resulting in the potential for increased virus spread. That, coupled with our region having the largest percentage of COVID-19 cases being variants of concern, provided simply too much risk for our health unit. The decision to remain in shutdown with the stay-at-home order in effect was not easy. And I know it was difficult for all of us, for our mental health, for our financial well-being, for our social health. It wasn't easy. And I want to thank members of the public for making these sacrifices to protect our most vulnerable and our healthcare system. Across the globe, the quickest path to long-term reopening has been avoiding the temptation to open too early. So as we slowly open, I am optimistic that we will continue on a positive course. If the situation continues to improve, we will continue to progress through the province's reopening framework, easing further restrictions. The opposite is true as well. If our situation worsens, we will have no choice but to put in place further public health measures. I'm hopeful that will not be the case. What I can tell you is that I have heard the call for more dialogue and more access to information. That's why our health unit will be hosting a weekly press conference on Thursday mornings at 10 a.m. and to continue to provide relevant information to the public and answer any questions you may have. This will become increasingly important as we progress through our vaccination plan for the region. As well, given the health unit spans 31 municipalities, we will also be holding meetings every 2 weeks with municipal leaders to coordinate approaches, streamline services, and ensure consistency in message so we are best able to plan and support our communities. This will be in addition to the weekly municipal operations meeting that has been taking place since the start of the pandemic. I'm hopeful that this increased dialogue and coordination will result in clear and consistent communication with the public. With that, I'd like to hand it over to Dr. Zimbalatti to provide more detailed update on today's case count and COVID-19 data.
Thank you, Dr. Chirico. Over the weekend, we had 1 case reported to the health unit, bringing our total case count to 269, with 174 in the Nipissing district and 95 in the district of Parry Sound. We currently have 4 active cases, with 1 case isolating in hospital. We also learned over the weekend that an individual associated with the outbreak at Castleholme that tested preliminary positive for a variant of concern is now confirmed positive for the variant of concern originating from South Africa. This individual had no known connection from the Skyline Lancelot apartments, but it is very possible he caught this virus from someone associated with the Skyline Lancelot outbreak while out in the community. The shutdown measures in effect at the time may have limited further spread. With this new confirmation, we now have 22 cases confirmed with a variant of concern originating from South Africa and 10 with the variant of concern originating from the UK. A further 13 individuals have been identified as being infected with the variant of concern, but we do not know the exact strain for these individuals at this time. That's the local COVID-19 update for today. With that, I'll turn back over to Dr. Chirico.
Well, thank you for that update, Dr. Zimbalatti. I'd like to now invite Shannon Mantha to provide an update on the lancelot outbreak. Shannon?
Thanks, Dr. Chirico. Okay, and I'm happy to be here with everybody today. As you're aware, we've been dealing with the community outbreak that's associated with the Skyline Lancelot apartments in North Bay. So to date, 45 individuals have tested positive for COVID-19 within this outbreak. So this includes apartment residents, visitors, as well as other individuals that we've been able to link to the outbreak through our case investigation work. 21 of the 45 COVID-19 cases have been confirmed positive with the variant of concern that originates from South Africa. And sadly, 3 individuals have passed away associated with this outbreak. We've been working with provincial experts to help us get to the bottom of the outbreak. Our investigation is ongoing with respect to trying to understand how the virus spread within the apartment building, and we will continue to provide updates to residents as well as the public as we learn new and more information. As you are all aware, the variants of concern spread much more easily and rapidly than the original strain of COVID-19. In fact, research shows they're about 50 to 70% more easily transmitted. And as Dr. Zimballatti's already mentioned, the UK variant of concern has also been confirmed in our district. I'd like to take a minute right now just to remind the community, especially as we begin the reopening process, that these variants of concern are present in the community. And because of this, we must remain vigilant and continue to practice all of the public health measures that we've been practicing throughout the pandemic. This means things like continuing to practice physical distancing, wearing face coverings that cover both your nose and your mouth, and washing our hands often to protect ourselves, our loved ones, and everyone else in the community. And with that, I'll turn things back to Dr. Chirico.
Thank you, Ms. Mantha. I'd like to now ask our colleague, Andrea McLellan, to provide a brief update on our vaccination program and rollout.
Thank you, Dr. Chirico. Good morning, everyone, and thank you for the opportunity to share our vaccine plan with you. As of this morning, we have administered a total of 4,467 vaccines in our district. We are currently completing vaccinations for those residents in long-term care homes, First Nation elder care facilities, and their staff, as well as alternate level of care patients in hospital who are now due for their second dose of vaccine. Additionally, we are currently providing first dose vaccinations for staff and essential caregivers in long-term care homes, as well as residents, staff, and essential caregivers in retirement homes who wish to receive the vaccine. Planning for vaccine administration in the First Nations communities in our district is currently underway, and vaccine will begin to be distributed this week. In collaboration with the hospitals in our district, vaccinating our highest priority and very high priority healthcare workers is currently underway. We are now focusing our planning vaccine rollout. We are now focusing on planning vaccine rollout to our highest and very high community priority healthcare workers, as well as individuals 80 years of age and older. Vaccines will begin to be provided to these groups in the next few weeks. When available, details regarding clinic dates and times, as well as how to book appointments for clinics, will be shared through the media, social media, our website, and through relevant healthcare associations. Both the AstraZeneca and the Johnson & Johnson vaccine have now been approved for use in Canada. We do not have confirmation on Ontario's rollout plan for these vaccines, but we are hopeful these new approvals will help speed up the rollout of vaccines in our district and in Northern Ontario. Things are beginning to move quickly regarding vaccinations, and we will continue to provide regular updates to the community as more information becomes available. And with that, I'll hand things back over to Dr. Chirico.
Well, thank you, Ms. McLellan. So that's it for our prepared remarks. And with that, I would like to begin answering your questions. And if you have any questions, please type them into the Q&A on the right side of your screen. Our moderator will read them out loud, and we'll try to cover off as many as we can. So Alex, please, if you could read the first question.
The first question is from Clark from Chirico. The Castle home situation still requires some answers as to why so many people tested negative immediately after receiving their positive test. What more can you share with the public and people who are upset that decisions are being made based on these false positives, leaving businesses closed and losing tens of thousands of dollars per week?
So I'd like to turn that question over to Shannon Mantha.
Sure, thanks. Let me just get myself off mute here. So, yes, so clarification, I'll provide a bit of context on that actually. So anytime there's an outbreak or positive cases at a long-term care home in the district, the health unit works collaboratively with that long-term care home to first of all, to prevent outbreaks and then manage them when they do occur. For the recent outbreak at Castle Home, the health unit and Castle Home worked together to investigate and manage the outbreak that occurred at the facility. Because there was some question around some of the lab results, some individuals had tested positive, and there was some question and further discussion and clarification required regarding those positive results. So what we did in conjunction with our with Castle Home is we consulted with experts in laboratory medicine at both the North Bay Regional Health Centre as well as Public Health Ontario to better understand the test results of some of the individuals that were tested, as they really weren't straightforward. And we are often asked, or since then we've often been asked, were the results false positives? And so the answer to that is no, the results were not false positives. And following consultation with the experts I mentioned earlier in laboratory medicine, as well as infectious disease experts, we did make the collective determination that these test results were positive, and then we managed them accordingly, which is why the outbreak was declared and sustained.
Thank you. Our next question is from Jennifer Hamilton McCharles. The North Bay Parry Sound District is last when it comes to vaccine per capita. Why are we getting so few considering we were just in shutdown? When are we getting our next allotment?
So that's an excellent question. Thank you for that, Jennifer. And I'll turn that one over to Andrea McLellan.
Hi, thank you for your question, Jennifer. When the vaccines arrived in the province of Ontario in December, allocations were made to the high priority hotspots within the province to ensure that it was rolled out quickly there. Vaccine supplies have been a challenge for the last little while. However, we have been made aware that the vaccine supply issues have now been resolved through Pfizer and Moderna, and with the introduction of AstraZeneca and Johnson & Johnson products as an option, we have more vaccines that will be available. We actually received a shipment of vaccine this morning, and we have been provided with allocations of vaccine on a weekly basis for the next 4 weeks, which will allow us to plan for the clinics that we're working on and have a sense of how much vaccine we're going to have for distribution over the next month or so.
Thank you, Andrea. Our next question is from Clark from Cogeco. In the recent provincial press conference on Friday, it was indicated that all frontline-facing healthcare workers are currently being vaccinated and are priority to get vaccinated. We know that the majority of front-facing healthcare workers in our district are not vaccinated. Can you indicate to frontline-facing healthcare workers that work in areas like home care, family health teams, nursing stations, and others in our health unit region when they can expect to receive their vaccine?
Again, I'll pass that question over to Andrea.
Thank you for your question. We are in the process of planning a rollout for those people currently. First step in that process was determining the number of people that are impacted by, not impacted, but the number of people in those priority groups. We're focusing on the very high and the highest priority healthcare workers who are front facing. The ministry has created a guidance document that we are following that outlines the order of vaccination that will happen in those areas. And so we are collecting that information, we are planning clinics, and now with having the vaccination information available regarding the number of doses that we're going to be receiving in the course of the next month or so, we hope to be able to roll out those clinics in the next few weeks.
Thank you. Our next question is from Dean Bellinger from KFM Radio. With worldwide concern regarding mental health, when deciding color framework or shutdowns, what mental health agency does the health unit consult with? And how much weight does the health unit place on mental health issues regarding the pandemic?
Well, I'll address that question, and thank you for that. And let me set the context for that question. I think it's really important to know that we work hand in hand with the government, and we are cautiously easing into this framework. We will make recommendations as to what we feel that needs to happen locally, provide input. The decision is ultimately the government's decision. And while there are certain factors that we have to take into consideration, we look at case counts, we certainly look at variants of concerns in our neighboring districts. And again, as I mentioned earlier, we're not an island, and we can't just look within our own boundaries. We really have to base our health recommendations on a number of different issues, and we have to look forward to see what's coming at us, and it is the variants of concerns. And I fully understand how difficult it has been for people's mental health. We know that it has been very impactful. We also know that we have to make some really tough decisions, and that I'm confident in the decisions that I've made because we have to look at the whole picture. And yes, it has affected people's mental health, and it has affected the physical and social health. And it's not easy on anyone. But our number one focus really has to be on the health and safety of the public and the most vulnerable. And we do consult and work with our partner agencies, but we can't solve all of those problems. It's going to take a long time to sort those issues out. And we really do need to work with the community to help with those people with mental health and to support them. And similarly with mental health issues, with addictions and overdoses, it has to be a community response. But what's facing us currently right now is a very deadly variant of concern, and it is killing people. And we have to address that. We know that it's impacting decisions we make are impacting mental health of individuals, but we can't ignore what's facing us and what could get out of control, what could overwhelm the healthcare system. So we take all that into consideration.
Thank you. Our next question is from Mo from Parry Sound now. What is the status of the outbreak declared at the McDonald's on Bow Street on February 27th?
So I'll pass that one on to either Shannon or Dr. Zimbalatti.
So I can speak to that. So the health unit did declare an outbreak, a COVID-19 outbreak at the McDonald's restaurant in the town of Parry Sound after 4 of the restaurant employees tested positive for COVID-19. And that would have been information that was included in our news release when that event occurred. All 4 individuals in this outbreak reside outside of the health unit district. And due to this, the health unit, our health unit, North Bay Parry Sound District Health Unit, investigates the outbreak, and the case and contact tracing is conducted by Simcoe Muskoka District Health Unit, which is our neighboring health unit. So to date, we haven't identified any additional individuals connected to this outbreak. So it remains that 4 individuals are involved in this outbreak, and the case management and our contact tracing activities have been initiated and are well underway.
I'd also like to add to that. I think it's really important that we point out that when we first learned of the variants of concern within our district, we acted very quickly and we remained in shutdown with the stay-at-home order in effect. And I think that it's important to recognize that had we not been there, potentially that a restaurant and other restaurants may have been open to the public. And in which case, with variants of concern, they potentially could have been exposing the public. But this didn't happen in this case. We were able to contain it. So that is an example of one of the reasons why specifically we stayed in shutdown with the stay-at-home order in place.
Thank you. A question from Sarah from the North Star. At the start of the vaccination program, the number of doses received wasn't public with security concerns cited. What safety steps or concerns are there for the public clinics that will start? What are the safety concerns?
Again, I'll pass that over to Andrea.
Hi, thank you for your question, Sarah. As part of the planning process for mass immunization clinics and at the recommendation of the Ministry of Health, we were required to complete a security assessment with our police services. That assessment was completed, and what they looked at was the transportation of the vaccine to our location, the security in place at our health unit as far as access to the vaccines, and then made some recommendations with respect to sharing information regarding the number of doses that we have received, as well as where we would be administering those vaccines. Vaccine supplies were very limited initially, and so the concern was for the safety of the vaccine and being able to get it to the clinics that were going to be using it at and administering it to the people who were the most vulnerable and highest at risk. And so we were following the recommendations of the police services to ensure that we had processes in place to protect the safety of the vaccine and ensure that it got to the places that it needed to get to for administration.
Thank you. Our next question is from Angela from CBC. If North Bay Parry Sound needed to pull the emergency brake on the province's COVID-19 zones and return to the gray lockdown zone, who would make that decision? And what would be the criteria for doing that?
I'll address that question. First of all, we're in constant communication with the Chief Medical Officer of Health, Dr. Williams. And if there is a change in the local status, we're able to reach the ministry and Dr. Williams, and we would have a discussion. First, what we would do is we would have an internal discussion, get as much information as we can, consult with the most appropriate people depending on the situation. And there's not just one indice or a case number that's going to trigger something like this. We have to consider not simply those numbers, and whether or not the healthcare system can handle it or the public health system capacity is being overwhelmed. There's a number of factors, and there aren't any hard and fast rules as to when we would use that emergency brake. In principle, we would want to apply that brake as early as possible if we felt that things were getting out of control. And that's how an emergency brake is designed. So we would look around to see what's happening in other jurisdictions. As I mentioned earlier, we aren't an island. We really need to make decisions not based on solely what's going on within our boundaries, but what's happening around us as well. So there isn't exactly one particular indice that would trigger it. And we look at the whole picture and in discussions with healthcare experts. We certainly rely on those, and Public Health Ontario has been an invaluable source of information. We would then collectively make a recommendation, but ultimately the recommendation would come from me, and based on that and the way the system is set up, that I would convey the local situation.
Thank you. So Eric from CTV, in some areas, COVID-19 vaccine pre-registration is now available for adults aged 80 and older. Does the health unit have an exact date or when the pre-registration will begin for our district?
Again, I'll turn that to Andrea.
Thanks, Dr. Chirico. Thank you for your question, Eric. At this time, as we speak, actually, there is a meeting happening right now to determine whether we're going to go with a pre-registration process or whether we're simply going to implement a call center, which would allow people to begin to book appointments, as well as using the provincial online booking system. Many health units in the province have access to online booking systems. We don't have an online booking system in our health unit. So we needed to create something for seniors, for healthcare providers, for the general public to be able to book appointments for our clinics. So what we are doing is we are going to be going live with the provincial booking system, which I believe is supposed to go live on March the 15th. And our call center will be live hopefully in the next week and a half to be able to have residents who are eligible to receive vaccine book their appointments.
Thank you, Andrea. Our next question is from Bienvenue at Radio Canada. The province maintains that all Ontarians who choose to be vaccinated should have at least their first dose by June 30th. How confident are you that this target will be met in our district?
Again, I'll pass that over to Ms. McLellan. Ms. McLellan.
Hi, thanks, Dr. Chirico. Yeah, on Friday, the ministry announced June the 30th as a target date for everybody to have been offered a first dose of vaccine. We've met the targets that we have had set out for us when we've had vaccine supply available. Our initial target date for vaccinations in the long-term care sector was met as required by February the 10th. And we anticipate that we will be able to meet the June 30th deadline, provided we have a sufficient supply of vaccine available to provide the immunizations.
Thank you. Our next question is from Greg from Moose FM. When would the area's homeless be vaccinated, and how would they receive their vaccinations?
Again, I'll ask Andrea to address the question.
Thanks, Dr. Chirico. We are working through the priority groupings as outlined by the Ministry of Health through the phased process for the rollout of vaccines. So we're still in phase 1. The homeless population currently sits at the beginning of phase 2. So it's going to take us a little bit more time to get there. But when we are ready to do that group, we will be working with the shelters and the local DSABs to determine the best method of immunizing for those populations. That's what we're trying to do with all the populations that we're immunizing. We don't have capacity to necessarily go everywhere where the public is, but where we can, and especially for those highly vulnerable populations, we will do our best to meet them where they're comfortable versus having them come to a larger venue that they may not be comfortable in.
Thank you. Our next question is from Jennifer from the Nugget. Will the second dose of the COVID-19 vaccine be the same brand as the first dose? Will vaccine intervals be extended longer than what the manufacturer has agreed to?
That's a very good question. Thank you, Jennifer. And I will pass that to Andrea. It certainly has been a topical issue lately.
Hi, Jennifer. Thank you, Dr. Chirico. Sorry, Alex, can you just repeat the first part of the question?
Yes, it says, will the second dose of the COVID-19 vaccine be the same brand as the first dose?
Thank you, sorry. Yes, the vaccines are not interchangeable. Whichever vaccine you're given for a first dose is the vaccine that you receive for the second dose. As far as the intervals, I know there has been a lot of discussion about extending the intervals. The Pfizer and Moderna vaccines have 21 and 28 day respective recommendation up to 42 days. And I know there have been discussions both at the provincial and the federal level with respect to extending that timeline to 16 weeks. And we are waiting official confirmation on whether that extension will be put in place or not.
Thank you. Next question is from Dean from KFM Radio. Does the health unit foresee a time when the Nipissing region is separate from the Parry Sound region? The distance seemed vast. And why is Callander part of the Parry Sound district? Thank you for your time.
Well, I can address that. This is all mandated through legislation as to what the districts are, what the health units are comprised of. We currently have 34 health units within the province of Ontario. And within our district, we have 31 municipalities, and that's the largest in Ontario. Now, of the 444 municipalities. Before the pandemic began, there was a process that the government was reviewing the organization of public health, and they were looking at reorganizing the health unit districts. And so that process was put on hold. But once this pandemic is over and we're through it, that they will revisit the modernization of the public health. So I can't really answer your question to say where we're going to end up. It's too early to tell, and it certainly is a situation that is ever evolving. And lessons learned from the pandemic may influence the decisions that are going to be made.
Thank you. Our next question is from Jennifer from the Nugget. Why are Lancelot residents having to go to the North Bay Regional Health Center for testing when previous healthcare staff went to Lancelot to test residents?
So I can pass that along to Shannon.
Sure. So yes, most recently, Lancelot residents were provided a date and time to do drive-through testing at the North Bay Regional Assessment Center. And so when we're, as part of outbreak management, we've offered frequent testing to the Lancelot residents as well as on-site staff. Some of that testing has been on site at the Lancelot location. And then most recently, there was drive-through testing offered to Lancelot residents. And that's just a combination of factors as to why the drive-through testing was offered. And it doesn't preclude us from returning to do on-site testing again. We do anticipate there might be more testing available to those residents and staff, and so it's just one avenue to get people out and get them tested.
I'd like to add that it is the acute care system that is responsible for testing. We try and coordinate with them, and the assessment center in North Bay has done a fantastic job in trying to meet the needs of the Lancelot residents, but obviously, they do have a lot of other commitments, so they're doing their best to provide the services that Lancelot needs in coordination with the health unit.
Thank you. Our next question is from Eric Thompson. There seems to be some confusion locally as to whether first responders, firefighters, police, paramedics are on the vaccine priority list. Can you clarify whether they are a priority group? And if so, where do they fit in the vaccine rollout?
I'll turn that over to Andrea again.
Thanks, Dr. Chirico. Great question. Yes, first responders, specifically first responder paramedics, firefighters, and police officers are considered in the priority listing. They fall under the highest priority section of the guidance document from the Ministry of Health. There are very specific criteria defined by the ministry for which they must meet in order to, it's not all firefighters, it's not all police officers. There are some first responder medical assistance criteria that are required, and they do fall under that highest priority category.
Thank you. Our next question is from Dean from KFM Radio. Is the color code reassessed weekly or bi-weekly?
Yeah, thank you for that question. We actually look at it every single day internally, and we have the ability to, if things change, and with the VOCs, things can change quite rapidly. So we have the ability to connect with the ministry at a moment's notice to be able to determine what we need to do in order to protect the health and welfare of our communities. So the ministry, the cabinet meets every Friday. They can then determine if they need to change things. They're assessing it. They communicate the results of their decisions. So it can be within a day, it could be a week, or every 2 weeks. So we really have to monitor it very closely and continue to be in communication with the ministry in order to respond quickly.
Thank you. Our next question is from Clark from Chirico. With 5 ICU visits and 0 patients requiring ventilators, is the level of restrictions warranted?
Could you repeat the first part? I didn't hear it. Sorry.
No problem. It says with 5 ICU visits and 0 patients requiring ventilators, is the level of restrictions warranted?
Yeah, I'll answer that one. And certainly it's a good question, because you look at one factor, and that's the health system factor. Is the health system under undue pressure? That's one criteria that we look at. And it's a very important one for sure, but that's not the only criteria that we have to consider And again, go back to what we talked about before. There are two main factors that were involved in putting us into first of all, the shutdown and stay-at-home order, and then into the red zone, rather than, while all of our indices were showing we're in green, there were two important factors, and that's the variants of concern. And let me first address that. The variants of concern certainly spread 50 to 70% more easily, more readily. And we know that within the province, they're continuing to increase, and we're seeing that. And when that happens, we have to take that into consideration as what that means for us here. And again, the other important factor that we considered in where we ended up was the fact that what's happening around us, other health units within our district, and what's the VOCs doing there. And we also know that if we are in a different color zone, either red or gray, if we're in a different color zone, people are going to travel to a less restrictive zone, and that has shown to increase the spread of the virus. And this is the best way to help protect against that. And we need to be still very, very cautious with respect to what we advocate to the public. The public needs to still maintain being very vigilant. Whenever they go out for essential reasons, and assume that everyone that you come into contact with that has the variant of concern. So you need to ensure that you're doing the physical distancing of 2 meters. You need to ensure that you are wearing face covering, washing your hands, using hand sanitizer. You still have to maintain all of those precautions. We're not over this yet, but I do believe that there's hope on the horizon, and working together, we can accomplish what we accomplished in the first wave, that we were able to slow the spread, and we were able to flatten the curve. And eventually we were able to, in the second wave, reduce the numbers. And even when we stayed in shutdown with the stay-at-home order, and we had all the variants of concern, we were able to contain it to the point where we were down to numbers that were in the green zone. So the public did a tremendous job. We're not fully finished yet, and we still need to be vigilant. And so I think people need to be very, very proud of all that they've accomplished. And I know there's been many sacrifices made. So that's what we're really looking for, the light at the end of the tunnel. It's there. We just have a little ways to go.
Thank you. So from Sarah Bissonette from the North Star, what is the number of people vaccinated / recovered we need so that we can breathe a sigh of relief?
I could start with that question. It's a very good question, and the answer as far as what number for herd immunity is what you're really asking, and that number is not totally known. I think that we have to take everything into consideration. For instance, if you look at what's happened with the variants of concern, with the province numbers dropping, they were dropping to a point where it was very, very encouraging. But we can't take that in isolation, because what we saw was a variance of concern starting to increase, and they are a game changer. So you can't simply go on numbers. When they talk about herd immunity, numbers can vary. They talk about 75% of the population being immunized, but there's too many unknowns at this time to make that prediction. And so I think that people have to recognize that we are going to move into less restrictions eventually. And when it's safe to do so, we can then remove the restrictions. But I think it's really important to remember that you want to have sort of reopening that will be long lasting, and so that we don't want to jump into it too early.
Thank you. Our next question is from Eric from CTV. When the health unit decided to close the OFSC snowmobile trails, skating rinks, and tobogganing hills back in January, did the health unit cease transmission from these public activities?
It wasn't so, you're never going to be able to prove that it reduced transmission. But what we do know is that at the time that decision was made, we couldn't ignore what was going on. We couldn't ignore what was being reported to us from very credible sources. And we were in a shutdown, stay-at-home order. And we knew that people were traveling out of district. They weren't adhering to the public health measures. There were many people that were traveling in vehicles that they shouldn't have been with other people that weren't within their household. They were congregating. There was evidence that we were getting complaints of 300 to 400 people coming up from other areas. We were getting complaints that people were gathering where they shouldn't have been. They weren't physically distancing. They weren't using their face masks. And it's not so much the activity itself that causes the spread. It's all these other things. So it's not being on a snowmobile. It's not being on a skating rink. It's not being going down a tobogganing hill. It was a problem that people weren't adhering to the public health measures that should have been in place. And that all risks increasing the spread of the virus. And we couldn't ignore all of the complaints that we were getting, and we acted, and we had to stand by that.
Thank you. Now we have time for one last question. This one comes from Radio Canada. Do you know where the vaccine clinics will be located across our district? Will pharmacies in the district be able to distribute vaccine?
So again, I'll turn that over to Andrea.
Thanks, Dr. Chirico. That's a great question. We are planning to hold our larger scale mass immunization clinics in North Bay, Parry Sound, West Nipissing, Mattawa, and the Sunridge area to cover off the 5 main hubs that we have. Depending on the population that we're immunizing at that point in time, there may be also clinics in smaller communities. Sorry, Alex, can you repeat the second half of the question?
Perfect. The second half of the question says, will pharmacies in the district be able to distribute vaccines?
Sorry, correct. Right now, there is a pilot project that's been planned through the ministry for the distribution of some of the vaccines in Southern Ontario to determine the effectiveness of using pharmacies for distribution of COVID vaccines. So at this point in time, I don't have any information that says that we will be having vaccine in pharmacies, but it is under consideration for both pharmacies and primary care at the provincial level. And when we have guidance from the ministry with respect to those, if that's the direction we're provided, then that's absolutely the direction we would be going to include both pharmacies and primary care offices.
I'd just like to add to that. Just wanted to say that the pharmacies have been a very valued partner in distributing flu vaccines for a number of years, and they've also certainly reached out to us to help with the immunization program as we roll it out for COVID-19. Similarly with the primary healthcare physicians and nurse practitioners, they've been amazing in helping us and certainly are included in our plans moving forward.
Thank you very much. So this concludes our Q&A for today. We look forward to seeing you all back on Thursday at 10 a.m. for our weekly press conferences. Thank you.